I will say emphatically, no. There is no signal here. I just want to hit a couple of points. Number one, it's important for us to document for the public what we are doing. We had questions very early on, well, what are y'all doing? Have you thought of this, and could you do that? What I'm reporting to you is the things that we have done. We have gone door to door to knock on doors. We've now knocked on 37,000 doors. We're running out of neighborhoods to knock on doors. We've called more than 150,000 telephone numbers and spoken with 74,000 people. We have run out and exhausted the list. That doesn't mean the work is done. It means we pivot to something different. I know Dr. Taylor will tell you that, as we mentioned, the Pipkin building is planning to close its doors on the 15th. Largely, we know demand will go down during the holidays. We understand there's some other events happening over there. We have a wonderful bowl game that happens over there. But rest assured that should the demand peak and should there be more need to do that, we'll open the doors again for people to get vaccinated, whether it's at the Pipkin or another public site. This is the normalization of vaccination. Just as we had the normalization of testing, you'll recall early in the pandemic, the public testing sites were really the only place you could get your test until it became more prevalent. More pharmacies, more laboratories, the hospitals, other clinics were able to test for COVID. We reduced the number and the throughput at the public testing sites because it became normalized. Vaccinations are now relatively normalized. You can get them at most pharmacies. You can get them at many clinics. Pediatric clinics are now coming into the fore with their ability to do vaccinations. And so the public vaccinations, this is how it ebbs and flows. We come together, we have high volume testing, we have high volume vaccinations, and then we normalize the distribution through what would be considered normal distribution channels. So there is no signal here. We are standing by and ready to respond to the demand. I will come back to the testing. What Dr. Taylor mentioned is it's important to know your status. Go in and get a rapid test if you're going to gather. Even better, go get a PCR test at one of our drive-through sites. It's free, it's easy, it's no cost to you. It may not be free to your insurance company, but it's no cost to you. And it's important for you to know your status. We still have plenty of capacity. Today, there are people, as we are speaking, waiting for you to go get your test. So please take advantage of that. The one thing I would like to share is if you want to get a test, please do not go to an emergency room to get a test. Go to your provider, go to one of our drive-through sites. What we haven't talked about in a while is hospitalizations. There are still more than 100 people in the hospital with COVID. That's 100 hospital beds that are not available for people with other maladies, and we don't need to increase the number of people there. So the work continues. Our hospitals are still very busy. Our nurses, doctors, nursing assistants, respiratory therapists are all incredibly busy and very tired. Please do not add to their workload unnecessarily by taking an unnecessary trip to the ER or asking for a test from the ER. But I'll wrap up by saying there is no message here. This is the normalization of work. We are still committed. The task force is here, and we will do what we believe is in the best interest of the community to make sure we meet that with the resources appropriate to the conditions on the ground. So with that, we thank you. Hope everybody had a wonderful Thanksgiving. Know your status before you gather. Make that part of your holiday planning. Thank you.
Thanks, everyone.